And joining us now is the Minister of Health, Patty Hajdu. Good morning, Minister.
Good morning, Rosemary.
I want to start, I guess, with some confusion that I think still remains in the country right now after the National Advisory Committee on Immunization this week said that Pfizer and Moderna were, quote, the preferred vaccines. I don't know if you agree with that statement, but could you maybe give a message to Canadians who are still a little bit confused about what that messaging was and what the recommendations were?
Well, first of all, let me be really clear with Canadians that every vaccine that's in use right now has been approved by Health Canada as safe and effective. And of course, NACI's guidance is for provinces, territories, and immunizers so that they can make the best decisions about which product to use for which kinds of people. And we've seen them make advice around age categories, for example, or certain kinds of approaches, for example. And but I will just say that the best and safest shot is the first one you're offered. And healthcare professionals are the best people to talk to if you have any questions about vaccination for your own health.
Is there right now any consideration about pausing the use of AstraZeneca because we have so much Pfizer coming into the country that we just sort of put that on the back shelf?
Well, I think, our approach has been to have a diverse portfolio of vaccines because there are a variety of different kinds of needs in the country, including geographical barriers, including different kinds of populations. And so our portfolio, as you know, has been diverse, built on that understanding that there are different vaccines that are right for different populations, and there are different realities in terms of how these vaccines are delivered. So right now we're working with the manufacturers of the approved vaccines, and in fact, we also have vaccines, Novavax, for example, Medicago, that have submitted to Health Canada for approval as they proceed down their clinical path. And we'll continue to assess the safety of all of these vaccines. This is an ongoing process. It's not a one-time and we're done. Health Canada continues to evolve their analysis based on the data that's accumulating in Canada, the data that's accumulating internationally, and we wouldn't hesitate to cease or pause the use of a product if it was shown to not have value, safety, or effectiveness.
I want to talk to you a little bit about rapid testing, because that was the announcement from the Prime Minister and you on Friday that now a lot of rapid testing will be sent to pharmacies so that businesses and others can access them. This is being done in part, at least, because the provinces simply have not been using the millions of rapid tests that you've sent them directly. What do you say to businesses then? Are you confident that they will use the rapid tests, given that the provinces didn't seem to want to?
I am, Rosemary, and in fact, a number of larger businesses have been using rapid testing as a layer of protection. Let's remember, there is clearly no silver bullet in the pandemic, and all along we've been searching for silver bullets to protect people, to save lives, to end the pandemic, but each tool is really useful, and rapid testing can really highlight for a corporation, and it has, by the way, that there are cases, very asymptomatic cases in the workplace, which then allows for the company to take action very quickly.
I want to ask you about some of the hotspots in the country right now. Alberta obviously continues to be a real concern, but Manitoba too is now the second highest case count per capita in the country. Is the federal government, and I don't like to ask this, but is the federal government prepared for a fourth wave? Is that a possibility, or is the pace of vaccination so good right now that we should probably be able to avoid one?
Well, I think the fourth wave, so to speak, is in all of our hands, and it really is governments, business, and individuals working together. There is no, again, silver bullet, and vaccination is a really, really important tool. So it's going to play a huge role. That's why we keep saying, when it's your turn, please get vaccinated. It will save your life. It will stop the spread. It will protect your family and your community. But we also know that we're going to have to stay on COVID from the experiences of other jurisdictions who have high degrees of vaccination, but still see outbreaks of COVID in various settings. And that's why all of these tools working together are so important. We can't take this virus lightly. We cannot we cannot assume we're out of the woods. We can see the finish line for sure, but that doesn't mean that the hard work ends today or ends in 2 months. It means that we will have this powerful tool of vaccination, but that all of us have to continue to work hard to bring those case numbers down and act on those outbreaks as quickly as possible.
Have you had any to-date requests from Alberta? I know they've been reticent to ask for help. Requests from Alberta for help or Manitoba? Has any other province asked for help other than Ontario and Nova Scotia?
We're in regular conversations with all of the provinces and territories about how we can best help them. I haven't been able to speak with my counterpart in Manitoba as of yet, but apparently we have a call lined up for next week. And of course, I'll be offering that minister as much support as we have to Ontario. I spoke with Minister Chandra about a week and a half ago, reiterated all of the tools that we can provide, everything from the Red Cross, contact tracers, help with testing, individuals come in and help with vaccination clinics. And Minister Chandra at that time told me that they didn't think that they needed that help. I know the Prime Minister had that same conversation. We're going to continue to be there for Albertans in any way possible. I'll be speaking with the mayors of Edmonton and Calgary next week. I spoke with the mayor of Wood Buffalo just a week ago or so and reiterated that we'll be there at the local level as well if they need our help.
There was another protest yesterday in Alberta. A gentleman was arrested. Other people were fined. There were 2 other people arrested in relating to a church. How much more challenging is it to deal with this or see this unfold in Alberta, given there seems to be a lot of resistance to the restrictions?
It's heartbreaking is the word that I would say for it. It's heartbreaking, especially to see faith leaders put the lives of the people that they're there to comfort and support at risk. And we've seen such a tremendous response by the majority of faith leaders, by the way, who have, in many cases, sacrificed in-person meetings, found other ways to provide support to their congregants, given that kind of spiritual support that so many people are craving during this time. And so what I would encourage all leaders to do is to put the health and safety of the people that they represent first and foremost. Of course we all want to be together. Of course, especially certain communities want to be together, communities that provide support for one another. But I think what we ultimately want is to not be responsible for the death of anyone that we love or care for the suffering of anyone that we love or care for. And we need to act together while we get towards this finish line that we can all see, by the way. We can have a better summer, but we have to take care of each other to get there.
Just one last question on the border. I'm sure you know that there have been calls by Senator Chuck Schumer and others for the border measures to start to be relaxed, or to at least start to have a conversation with that. Vaccine hesitancy is becoming a problem in the U.S. Now. I wonder if you have a sense of what kind of health measures or metrics you are considering in order to have that the border restrictions relaxed. Would you have to reach herd immunity in the U.S.? Do you have a certain percentage of what you would want to see? What kind of conversations are happening around that?
Yeah, it's a very tricky conversation, actually. And the G7 health ministers had a meeting last Friday where, in fact, I asked for border controls and measures to be put on the agenda. We had a really good, fulsome conversation. Every G7 country is struggling with this question because, of course, reducing importation is so important. But also, as the world begins to vaccinate, how we manage vaccination at the border is increasingly becoming a conversation. For us, I think we're looking at the domestic situation in terms of our own caseload. How many Canadians are sick? What's our healthcare system look like? Do we have surges in parts of the country that are posing a great risk to Canadians? We're also looking at vaccination rates of Canadians so that we have that domestic protection. But of course, we have to keep an eye on the international scene as well. We know certain countries are raging out of control, that variants continue to emerge as this virus looks to escape vaccines and indeed it evolve its infectivity. So it's a complicated conversation, Rosemary, but I'll tell you that the world is struggling with it, not just Canada. How do we restore international travel and trade in a way that is freer so that we can also protect our citizens and have some resumption of that global economy and travel that we all crave?
Okay, Minister, I'll leave it there. Thank you for your time this morning. Appreciate it.
Thank you very much, Rosemary.